patient with a thyroid. Please make sure that he is sitting comfortably on a chair. Please don't drag the examiner's chair. Take your chair offer him. Make a space so that you can move at least from left to right and stand behind. Make sure that you have that space. This is very vital. These are parts of the drama that you need to learn. Where should you stand? You should stand on the right side of the patient. Next, how should you stand? You should not stand like this. Don't laugh, because the next day you go to the clinics, your OPD, etc. You will see how common bad manners are. It is so common that it cannot be said bad manners in all. But always, you do not touch the patient. You do not do this. You do not remove his clothes. Don't laugh, because you will see how common things are. We make these mistakes. You do not stand like this. You do not stand like this. If you are having a problem with your hands, take them back, scratch your back. That is the easiest way to do with your busy hands. I know your hands are trembling. Okay, don't put them in your hand pocket. Don't do like this. Okay, in your exam time. Okay? Now, in your thyroid examination, in inspection, the patient is sitting like this. Then please, if you have a joler bottle like this one, this is always beneficial. Always carry one even in the month of January when your exams will be. Chota pani ka bottle also helps. If you are lucky enough to have a glass like this one, it is always better. Ask the gentleman to remove a button of the shirt. Jamar ekta button khule din. Dhonnobad. Then, jolta খেয়ে নিন. You are my examiner. Dhonnobad. Thank you. Please do not do juggleries by জলটা মুখে রাখুন, যখন বলবো তখন খাবেন. Please don't do those things. Try to do that thing on your own self and then you shall understand. What did you see? Sir, I saw a swelling in the midline of the neck that moved up and down with deglutition. Suggestive of that is a thyroid swelling. Please remember my words for your exam. That's it. A swelling moves up and down with deglutition as this gentleman did. Prove this is a thyroid swelling. और हमें कुछ proof नहीं चाहिए sir. Number 2, गिफ्ट एक बार करूँ. That's it. What have you seen? गिफ्ट एक बार करूँ. You saw that video. I am seeing for movement with protrusion of the tongue. Now, sir, I have seen a swelling in the midline with movement which moves it up and down with deglutition. No movement with protrusion of the tongue. और तुम्ही की देखले, so I have seen the skin over the front of the neck and the chest wall, which is normal. और आपने क्या देखा डॉक्टर साहब? Sir, I have seen the lower border of the swelling. और आपने क्या देखा है? Sir, I have also seen for other swellings in the lateral side of the neck. What other swellings are you expecting? Sir, lymph nodes. If there is a lymph node associated with the goiter, what do you think? Sir, it's a malignancy. Where do you expect the lymph nodes to be present? So I expect them to be present in which triangle of the neck? Which triangle of the neck? Sir, the anterior triangle of the neck. Please remember, all swellings in the midline are thyroid until you prove them not to be anything. All swellings away from the midline in the neck are lymph nodes until and unless you prove they are not lymph nodes. This is ये रामानुज का rule नहीं है. This is a God-gifted rule. God gave to me one day in my dream, told me this. So that's it. Lymph nodes by the side of the midline are lymph nodes. Swelling in the midline is a thyroid. Bus. Until and unless you prove them to be something else. Next, anything more? Yes, sir. Before proceeding to inspection, I have ruled out the intra-thoracic or the retrosternal extension by a member test. So see that I have said you only 7 items for inspection. That's it. That is what people are required to do. Then, how have you done inspection? Sir, I have done inspection in sitting posture. Do you know of any other technique of doing inspection? Sir, I can also do the Pigilo's technique. Again, Pigilo is a man glorified by Indians. You should be very happy. No other European nation glorifies him. So, how is the Pigilo's technique done? Sir, the patient is requested to put his hands behind the head. Now please don't do this in front of the examiner. Does not look good. Okay, so please don't do these things. Does not, examiner gets afraid. So don't do. Tell to the patient, হাতটা মাথার পেছনে নেই. Now see, what mistake have I done? I could not explain to him. হাতটা মাথার পেছনে নিয়ে নিন, মাথা দিয়ে হাতটাকে ফেলুন. It should not be উল্টো, হাত দিয়ে মাথাটাকে ফেলুন. That means this will promote an flexion of the neck which you do not desire. You desire an extension of the neck which will be মাথা দিয়ে হাতটাকে ফেলুন. Please learn to my words. Each of them are very important. This is what we shall be required. Now we did. A piggy-nose method is to be done in short-necked obese. For nose, examiners always feel piggy-nose is important. Then, the last test to rule before palpation is a belly button, which I have done by requesting the patient for maximum abduction of the hands with to narrow the thoracic inlet. হাত দুটো মাথার উপরে তুলে দিন. Now at this stage, stand back, flex his hands so that the inner aspect of his arms touch the ears. This is being done to narrow the thoracic inlet. নিঃশ্বাসের কষ্ট হচ্ছে? আমি দিন. Ask the patient one dialogue only. নিঃশ্বাসের কষ্ট হচ্ছে? See for the front of the chest, see the face. What are you looking in the face? Congestion. What are you looking in the front of the chest? Prominent veins. What are you asking? Respiratory difficulty. This suggests a retrosternal extension. Now proceed to. Am I clear with this? The next day we start with palpation, end with toxicity, thyroid method settings. Okay?